This is a fun talk. I'm not talking about where to put the ACL and that kind of stuff. And Dr. Richmond, by the way, was on the faculty of Boston Children's Hospital before he moved to Washington. So a hypothesis I'm going to put forth to you, and this is not just maybe physicians, but physical therapists, athletic trainers. We often wear two hats. We wear the hat of the treator, or sometimes surgeon, and also, if we are in the role of a team physician, our perspective suddenly changes. And I think that that's the theme we're going to talk about when it comes to prevention. As treating physician or surgeon, your focus is on doing the best job you can to make a proper diagnosis and to make a proper treatment. And Min and I were talking this morning about the ACL Study Group. ACL Study Group is an international organization and spends most of its time talking about how to fix the ACL, double bundle, single bundle, all that kind of stuff. But if you're a team physician, you have a somewhat different perspective. And this is my old buddy John Bergfeld, my old rugby buddy, as team doctor for the Cleveland Browns. And I will again suggest to you that in this capacity, you're suddenly dealing not just with diagnosis, treatment, but you're also looking at prevention, training regimens, and even dietary panels and so forth. So if we go at long-term historic perspective, we have to include the Greek city-states, the Olympic movement, and so forth. And of course, it's ho-hum, the Greeks again. But as a matter of fact, they were just like you and me. They had exactly the same brains as we do. There's no change between us and 500 BC, except the fact that we had more tools to approach some of these problems. And I can focus on one particular Greek of that time, Professor Herodikos. He initially was a coach. He began as a coach in the gladiatorial Olympic-type game training for both men and women. Then he became a physician, and he went to Knidos Medical School. Hippocrates, he was a contemporary of Hippocrates, same time Hippocrates was at Kos. And Dr. Herodikos recommended that, or suggested that bad health result of imbalance between diet and physical activity. And there is, as a matter of fact, in honor to him, there is a Herodikos Society, International Society of Academic Sports Medicine Doctors. And there are 3 members of the Herodikos Society in this room. These games began as a way of preventing war. There was a time when the city-states were constantly warring. Then someone came up with the idea of let's have athletic competitions instead as an alternative to war. And we have different perspectives on this thing. This is one of my cardiology colleagues, who's also a member of the International Federation of Sports Medicine, and noted that they've excavated a hospital near Athens, and there was a surgical section, there was a clinical section, and there was an amphitheater, and there was a sports gymnasium as part of their prevention, if you will, and their improvement of health through exercise. The Renaissance literally means that, the renaissance, the reinterest in the art and the knowledge of ancient Greece and to some extent ancient Rome. And again, themes that seem rather modern to us when we look at the concept. This is a famous book, De Arte Gymnastica. Professor Moccarale was from Padua, and this comes from that book. I was given a copy of this book by most of my Italian colleagues. And medicine has 2 parts, curative and preservative. Preservative medicine is in turn divided into 3, prophylactic, averts future disease, preventive, defends existing health, and restorative, those who are ill are restored. That could come from a textbook written in the year 2013. They had the concepts then in the Renaissance of the idea of preventive medicine. And this is an excerpt, a plate from that book showing men practicing climbing ropes as part of their health promotion. Now to modern times and the increased interest in the care of the athlete and the medical care of athletes in general. The revival of organized sport, 19th century primarily. There were crew competitions in the 1860s. I have a photo of one of the Harvard crews of 1864. However, for all practical purposes, the Olympic game restoration, 1894, they met in France to form the Olympic Committee. Pierre de Coubertin. The first game was in Athens in 1896. International Federation of Sports Medicine was founded at the St. Moritz Winter Games. It was the first international society looking at the care of the athlete. And again, in that context, you're always thinking prevention. And then finally, the IOC Medical Commission became part of the International Olympic Committee. Initially, they were dealing primarily with drug testing. This was the 1,000-pound gorilla on their back, They were struggling with this and the cost of it and so forth. WADA was formed, as I was talking yesterday, WADA was formed, World Anti-Doping Association was formed in 2005 and took a lot of the burden off the IOC Medical Commission of drug testing. And they were able to progress, particularly with the leadership of Lars, into injury prevention. And they now host injury prevention summits in Lausanne. This is one of them. I was privileged to, I participated in 5 of these. And this was the one on the prevention of ACL injuries in the female athlete. And there's some Americans in there. And there's Lars over on the right and our colleague. But this has been a wonderful thing. That you're there for 3 days. You come up with a paper on the Saturday morning in a final version of it. It's in English, of course. And then by 5 p.m. that day, they have the press releases out in English and French. And that's called Swiss efficiency. Very, very, very impressive. Very well organized. So now we have a different trend in recent times, and this is the IOC brings up on the right, and you see lifetime injury prevention, and the editor is Lars Engebø, the British Journal of Sports Medicine, which, by the way, if you haven't seen the changes in this journal in recent years, it's astounding the way it's gone toward health promotion, injury prevention. Reducing cricket injuries, making injury inroads with surveillance, surveillance being the first step in injury prevention. You have to know how many injuries you're having before you could measure whether an intervention has prevented injuries. Mission Possible, sports injury prevention, step-by-step in Norway. And Dr. Engelbret's colleagues. The history of the sports and injury prevention in the United States is an interesting one. Physicians, of course, have always been in hospitals working on traumatology and so forth and this type of thing. But the organization of university competitive athletics, which began 1870s, 1880s, 1890s, the game of rugby football was played first in this country in 1874, right down the road by the Harvard Business School, Harvard versus McGill. This evolved into gridiron football, and concomitant with that, Dr. William Conant at Harvard in 1890 formed a medical department of the Harvard Athletic Association. Initially, this was a Harvard Athletic Association put on these sports, put on in particular football, running competitions, rowing, and so forth. And early on, we began seeing papers coming out looking at the athlete and their health and the response to exercise. The famous Professor Darling, Boston Medical and Surgical, 1899, Effects of Training on Harvard Crew. They looked at training of athletes in the running events. This is a historic paper of 1909. Football injuries of the Harvard squad for 3 years under the revised rules. The revised rules were no more flying wedges, and they introduced the forward pass into football. And that was because Teddy Roosevelt said, as president, he said that if football did not improve its safety, he was going to ban football for the United States. As a matter of fact, on the West Coast, a number of the universities there took up rugby as their sport. I'm going to talk about rugby. This is a famous sports medicine book in the United States. It's the first one really written for the team physician. Athletic injuries, prevention, first word, diagnosis and treatment. Now here's Augustus Thorndike. Now he's a team doctor. He's also a physician, goes to hospitals and takes care of his own patients. But he published this. This is the 3rd edition. I have to have a copy of it by Dr. Thorndike. I give him to Thomas DeLorme, an old colleague of mine. He published his book first in 1936, 1942. The 2nd edition, he went in the military, as most physicians did, and most men in this country in the late 40s, early 40s. But in his books, he described how there was a chapter on training regimens and how they could promote the health and safety of play. He asked for a diet and nutritionist at that time, in the early patterns. Mandatory protective equipment. Up till then, it was basically you put on whatever you wanted, more or less. And they had trainers at the Harvard Athletics starting in 1925, generally with a physical therapy background. I have a teaser for the physical therapist in the audience, a historic teaser. Who was the first physical therapist in the Boston area to have a private practice of sports injuries outside of a hospital setting? Think about that. Some of you probably know that answer, but just a little teaser. So this is the first chapter in Thorndike's book, Prevention of Injuries in Athletics. And he talked about the gradual evolution of organized college sports from the uncoached, unattended teams in the 1880s to our present state of systematic and well-managed programs and so forth. So way ahead of his time in some ways, talking about prevention. Remember now, he's a team doctor. He's not just someone sitting in an office somewhere waiting for patients to come in. As you've heard, our division was founded in 1974. We think it was the first one in this country, probably the world, to look at kids' sports injuries, and it's grown to its present status. In our articles of incorporation of our foundation in 1978, we stated that our goal was to diagnose, treat, and prevent sports injuries in children. We've done a lot of the first two, but not too much of the third one until maybe recent years. But some of our early papers, we looked at preventing, and it's been an interest of mine for some time. This was some of our early papers had this: risk factors, host factors, environmental factors, to the present day where been very nicely subdivided by Dr. Emery into extrinsic risk factors, which are non-modifiable or potentially modifiable, and then intrinsic risk factors, which are non-modifiable or potentially modifiable. And the potentially modifiable is where we come in, is where we can intervene and help prevent sports injuries, or at least reduce their severity. Now, I did warn you about rugby. And this is my interest to some extent was in prevention of injuries was piqued by the people say, oh, rugby, what a violent, terrible, dangerous game. Well, I played football and I played rugby, and there's no question where more of the injuries were occurring. American football with its protective equipment, okay? But, and I know a little bit about rugby injuries. That's Harvard Stadium behind us there. I made a mistake of playing in the sevens tournament one time. This was one of my first published articles, 1974 again, about the same time we were starting this program here. We looked at the incidence of injuries in rugby football in the Boston area and found that there was a reasonable, relatively low rate, 82% did occur in games, and our focus of prevention in rugby has to be in the game situation and shoulder injuries. This was a conference we put on in Boston. In 1990, we published it. The actual meeting was in 1988. To our knowledge, it was the first international conference on rugby injuries. The title was Preventing Rugby Injuries, maybe a predecessor to such meetings as we're having now. And this was the journal that came out from that, the proceedings. Mark Jenkins is in the audience here, one of my former rugby opponents. And we put together this Preventing Rugby Injuries. So the following year, I was invited to Edinburgh, Scotland for the first IRB Sports Medicine Congress on Rugby Injuries. My title of my talk was Prevention of Injuries in Rugby Football. So I sit down, and then basically, I'll go back a second. How do I reverse this? Anyway, I'll show you that in a second. But anyway, so we subsequently have done a number of studies from this center and with our colleagues in Ohio State, looking at rates of injury in high school, rates of injuries in college, looking at the rate of exposure, and we have shown that at the college level, rugby has about the same rate of injury with good hard statistics as soccer. Nothing near what American football has. Prevention of rugby injuries, we now have a number of colleagues, South Africa, New Zealand, who are systematically looking at the actual techniques in rugby, which, and this is proving, I would present this as a case study in how a sport can approach its injury problems. We depowered the scrum in rugby. Most of our serious catastrophic injuries used to occur when the scrums impacted each other. We depowered the scrum. They can't do that anymore. It has to be a consortium of players, coaches, referees who are in on safety. And then you watch college football games, know that doesn't happen at the college level. You just want to watch, see head-to-head, you just watch a college football game. The pros are getting onto it now in gridiron football. But in rugby, as in soccer, we now have the referees have red cards and yellow cards. And basically, for instance, on a kickoff, if a player goes up in the air and is tackled in the air by opponent, red card, out of the game. What if we had red card, yellow card in American professional football? Would that capture the attention of a coach or owner if their star linebacker was thrown out of the game for hitting with his head? Okay. And then finally, of course, the rules of the game have to reflect safety concerns. And I think that's coming in many of our sports, certainly in this country and in gridiron football in particular. So once again, returning to the team physician, we're back at the home stand. The team physician is responsible for field side coverage, along with his colleagues and his support staff and the trainers and therapists and so forth. Training room office on tour and evolved distinctly with prevention. The American College of Sports Medicine has a team physician course. It's not a sports medicine course, it's a team physician course, which you could take in 2 parts, and at the end of which you're qualified to be involved in this preventive aspect. We are required in our fellowships now to have our fellows cover teams to get into this end and this approach to prevention. And so for the team physician, the pre-participate evaluation is a very invaluable tool. Our fellows and physicians are all over town going to different places, schools and so forth, helping out with pre-participation evaluations, particularly in some of the underserved communities in the Boston area. We think it's an extremely important opportunity for us to identify risk factors in these kids. So this is a concept that's been around for some time. Injuries is just part of the game. I'll finish my story about the International Rugby Conference. I sat down, and the chairman of the International Rugby Board stood up. He happened to be an Australian neurosurgeon. Stands up, he says, "You can't prevent rugby injuries. You just get out there and play, and if you get injured, you get injured. That's the way it goes, you know." Okay, I thought I just gave a talk on how to prevent rugby injuries. Anyway, but injuries are not just a part of the game. We can modify. These games are played under rules that are modifiable. They're officiated by officials who have the rules, the power, if they wish to invoke to throw a guy out of the game who was doing dangerous play, unethical play. And in this group of kids in particular, the young athletes, I think there's no question who would disagree with the fact that for children's sports, sports medicine for children should be preventive medicine, basically. Although I heard an anecdote last night that a young athlete said to his mother, "Why is this coach so concerned about who wins a fourth grade soccer game?" It was Dr. Coker's wife told me that. So the first step in injuries for prevention is injury surveillance. This was a paper published by the World Health Organization. This is a meeting we had in Hong Kong in 1997. And we asked under that meeting that for kids sports programs, sports injury surveillance, requirement for youth sports programs, and mandatory coaching, training, injury education, prevention. Thank you very much.